Welcome to the special edition of the Pandemic Podcast, where we will examine the question of whether the European Parliament is finally listening following the International COVID Summit this week in Brussels that I personally attended. In this episode, I'll be sharing my reflections on this week's event, having attended the full summit on Wednesday, the 3rd of May, and witnessed the vast majority of the talks throughout the session, and indeed several of the panel discussions the following day. Now, what marks this iconic summit is the fact that it was held at the European Parliament, which begs the question, are we finally getting through? Now, during the course of this episode, I'll examine what this all means, but it's fascinating. We'll examine the question of correlation and causation in the context of some of the pharmaceutical implications. But interestingly, in the wake of the International COVID Summit, Tedros, the Director General of the WHO, has announced that the public health emergency of international concern regarding COVID-19 is now over as of Thursday. So his committee met for the 15th time, and they advised him that it's time to call an end to the international emergency. So it's official, folks. The pandemic is now over. Now, what's fascinating about this is the trending keywords on Twitter, in stark contrast, are one, hashtag COVID isn't over, with over 1,000 tweets. But interestingly, alongside that is also hashtag vaccine genocide, which has 4 times the amount of tweets. We'll lean into some of the sentiments around these hashtags as we go through the discussion, because both in some ways are relevant. But it's official, folks. You heard it here. Well, not first. If you've been paying attention, you already know this. But we don't really need an official body to tell us when something is and is not an emergency, I think. But it begs the question of what role the WHO should play in any future emergency, and we'll talk to that point in the context of the conversation. Now, the International COVID Summit featured an enormous amount of speakers across the 3 days. The primary summit on the Wednesday covered a number of different topics. Now, the focus of the event, given that this was held at the European Parliament, this was being recorded for the European Parliament and transcribed for the European Parliament. And of course, the event as a private event was live streamed across the web to multiple countries. So the public could also watch along, and good on you if you did tune in. It was a heavy day, quite frankly, because the whole purpose of the event was really to kind of draw together a critical analysis of the response to COVID-19 throughout the COVID chapter, in many ways similar to the lockdown summit that we hosted back in 2021. In fact, the summit that we hosted in 2021 was one of the very first summits to address these questions, certainly the first physical summit to do so, certainly in the UK. But now here in 2023, this summit is another important moment of reflection whereby different doctors, scientists, medical professionals, legal professionals gathered from across the world to take stock from the very beginning, looking at the way in which the world responded to this novel virus. And the session ran from 8:30 in the morning right through till 6 p.m. at night. And many of the sessions actually overrun, so the latter sessions were condensed towards the end. But I'll run through the program. I have it here. Firstly, in the morning, the first section was called COVID-19, the whole truth from the beginning. So to my point, it really was a whistle-stop tour of the key failings, if you will. It was a critical analysis. It was really looking at what went wrong from the very beginning, with a panel that featured Dr. David Martin, Nick Hudson, and various others from other parts of Europe, before the second panel looked at the effects of mandates, the efficacy and availability of early treatment, and the media's involvement in the response to COVID-19. Following that session, the conversation turned to the vaccines and looking at the trial data and what we know in terms of efficacy, in terms of the latest empirical evidence. followed by a discussion session with 3 of the members of the European Parliament. So this was, as I mentioned, held in the European Parliament, and I'll comment more in a moment about what that means. But there were a number of MEPs in attendance and, in fact, speaking. So three of the MEPs gave their view on what had happened from a critical stance, and then that was followed after lunch with a further critical analysis of the COVID-19 vaccine, looking at the latest evidence with regards to the effects on the reproductive system, both within adults and children. And then later in the afternoon, the session turned to other subjects relating to the vaccine harms, before concluding in the later afternoon, looking at the legal implications, the human rights implications, and the onward consequences, looking at the prospect of the pandemic accord put forward by the WHO, or otherwise known as the Pandemic Treaty, and the international health regulations. So you could argue that the first part of the day was looking in the rearview mirror at the response to COVID-19, including what we've learned about COVID. There was a piece from a number of the different scientists looking at the evolution of the virus, what we know now, and that led into the conversation around the fact that this is a treatable disease and had been since the beginning with the existing treatments that are available. So it was a full day of discussion, high-level discussion, presentations, giving a stark recap of the last 2 to 3 years and the emerging evidence. It was positioned well at a level where you could follow as a kind of lay member of the public, but there were also elements that were more scientific that would require additional background knowledge. But the vast majority of the content was positioned at a level, understandably, given that not only was it addressing members of the public, the media, and the members of parliament, it needed to be at a level whereby you didn't need a career in either academic or professional scientific, within the scientific profession to actually be able to garner and understand the material. But I want to speak to, firstly, the question of, is the European Parliament listening? Now, firstly, given the fact that this conversation was happening in the European Parliament building in Brussels, is a marked move forward. So irrespective of the fact of whether the European Commission or the European Union pay any attention to the content that was shared, the very fact this conversation was permitted to openly occur within the realm of the European Parliament is a massive leap forward. We know that any critical conversation around public policy, vaccinations, is simply being shoehorned out of the official offices. We've even seen, quite literally seen in the UK, for the international audience, if you haven't seen this, we've had members of the whip literally shooing MPs out of the Houses of Parliament the moment any MP actually raises the question of safety or efficacy when it comes to the vaccines. We saw the House clear when Andrew Bridgen MP started to raise the issue in the House of Parliament. That's how futile this topic has been within the political context. Now, I want to be fully transparent and clear. You'll see footage from this event where you can see, obviously, the official backdrop. You can see the fact this was held in official parliamentary buildings in a hearing context. However, it's important to note that this was not an official hearing in the sense that this was not an audience of MEPs and government officials and European officials listening and observing this hearing. It's important to really have transparency on that and be fully honest about the audience here. The material, though, was fully recorded and will be transcribed and will be submitted to the European Commission, who are undertaking a review of the response to COVID-19. But you will see clips across social media that give the impression as though this is people giving testimony to the political fractions. It's not the case. There were MEPs in the audience, but it was a space that was created for a hearing where testimony was provided but it's important to understand the context. But the critical point, there are two critical points. Firstly, the fact that this was enabled to happen in such a setting is a huge step forward, and I think a stepping stone in the right direction. There's already discussions of another conference now in Europe's second or the Europe's largest parliamentary building in Romania. The only government building that's larger than this Romanian facility is the Pentagon in the United States. And if we can make our way there, then we're making really good progress. But the fact that this official hearing, in the sense that it was a sanctioned summit, not official in the sense that it was not called upon by Parliament itself, is a really strong development. Now, the second key piece is that this, as I mentioned already, is being submitted to the European Commission. Now, whether that evidence will in any way be taken seriously, whether it will be incorporated into any body of work, we don't know. And quite frankly, my primary takeaway from the entire experience goes full circle to the work that I did on this very show when I first launched it back in 2020. The intention behind creating the Pandemic podcast was to ask the questions that the world seemed unwilling to ask. That was the long-time strapline of this show. Because at the time, way back when, before the likes of Russell Brand and Joe Rogan and Jordan Peterson and other Tucker Carlson and other big names. In fairness to Tucker, he was pretty consistent, and Joe got in there relatively early on. But before there was really a major conversation around these key issues, there were very few of us asking critical questions, at least at scale in public. But the reason I did so was because I thought it was necessary. Well, firstly, the reason I did so was because the growing gap between the realities and the perception of reality created by the media and the governments, and the propaganda and the behavioral nudging and the fear mongering. But the intention was to support a public awareness, to bring the conversation to the public where very few others were doing so. Now, coming full circle, I really do believe that there will not be a seismic shift in the way that the conversation around the management or mismanagement of COVID-19 and the vaccine campaign has unfolded. I do not believe that that will reach a critical mass until we also reach a critical mass of public education. Not just public education, but a point where there are sufficient people who are demanding answers, that demand accountability and justice. I think a critical mass is required before that will be taken seriously. But I do believe fully that we'll reach that point. And in fact, the irony of the whole thing here, and we'll all be nodding when this happens, but I do know at some point in the future, I don't know, I predict at some point in the future, we will see the talking head shows on the major TV channels, even the BBC, Panorama, or some major BBC documentary on the mainstream media, looking back in the rearview mirror saying, how do we get it so wrong? You might find that hard to believe right now, given everything we've been through, but I can see it. I can already see it happening. But we've got a long way to go until that point. We know that. It's hard enough to even get this summit covered in the media. In fact, I haven't seen any mainstream media coverage of this summit whatsoever. Quite frankly, I've seen very little alternative media coverage of this summit. I was lucky enough to be one of the only representatives from the UK in the audience, both in terms of media representation, alternative media, new media representation, but also just as a citizen. So we've got work to do to get the word out there. This is a really important conference, and it's really critical that we continue, because a lot of people, understandably, summer's coming, want to get on with their lives, and it's draining. I will confess, it's absolutely draining. After the first day of being there, as I shared in a live video this morning, it's energetically challenging because it's heavy. It's heavy material when we look at over old ground and see the damage and harm that's been done, because the reality, significant harm has been created from the response to COVID-19 and the pharmaceutical interventions. We've seen society polarized. We've seen education, you know, completely decimated. There's millions of children who still haven't gone back to school or into full-time education. You know, millions of days of education were lost. Hospital waiting lists are still recovering from the backlog. We're seeing a huge rise in preventable diseases because hospitals shut their door to almost anything but COVID. And the economy, as we know, is in dire straits. Mental health challenges are through the roof. There's not enough support to go around. The waiting lists for mental health support are now, in some cases, in the 5+ year mark. And if you're in a place where you're experiencing extreme anxiety or anguish, you haven't got 5 years to wait, quite frankly, which is why we're seeing the suicide rate still continuing. So all of these challenges are unfolding as a result of policy. But there are people celebrating the fact that we had these lockdowns and interventions that, in their mind, even though the data doesn't actually verify it, they were successful. I mean, Fauci's on like a media celebration tour right now. It's insane. It's insane to think about how the public perception has been altered so distinctly from the reality, which is why we're seeing trends like the hashtag trending COVID isn't over. And if you go onto Twitter and you look at the hashtag, and please do so with sympathy and empathy, because the reality is many of these individuals are victims of the propaganda machine. And you've got very real problems, like people who are immunosuppressed or immunocompromised. I'm someone who has a history of autoimmune conditions, so I could be considered in a risk category. But the reality is those who are immunocompromised, unfortunately, who are now worried about this end of the official end of the pandemic, according to the WHO, clearly, over the course of the last few years, they felt their life is under threat. But the hard reality is now in this, and it has been for much time, is that the risk level of other circulating viruses, diseases, bacteria will continue and will always sadly pose a threat. What we really need to be looking at in these circumstances, and you would have thought, given a major health event, that we would now be having a global conversation about how we improve our health, because well, where autoimmune diseases come from could stem from the latter part of this conversation when we talk about pharmaceutical interventions. Who knows? But how we live our life, the lifestyles and the way we nourish ourselves and the world that we live in should be a big part of the conversation right now. Rather than talking about how we actually radically improve preventative health, we're hearing about the pandemic accord and the international health regulations, which is really centered around pharmaceutical interventions, and not just that. But an increasingly centralized approach to public health from an entity that has, quite frankly, failed over and over, not just during the course of the pandemic, I'm referring to the WHO here, but more broadly over the last 2 to 3 decades since the funding structures changed from being a member-funded organization to a privately funded organization. In the 80s, the WHO opened the door to pharmaceutical companies, private investors, and even the former director generals of the WHO have spoken about how that funding comes with a expectation, how that money will be spent and how it be directed. And it's no surprise that commercial interests have now corrupted the very heart of WHO. And it's not, I think there are extreme views on the WHO, and I think we have to be fair. A lot of that criticism that's levied is playing out. It's not to diminish the individual good work that many of the doctors and scientists may have done over the years, but that's now being tainted by the way in which the WHO is structured. And again, that is a part of the conversation from this summit. There was a whole session on warning about the consequences of the WHO's pandemic treaty or the accord and the international health regulations. Ultimately, people have lost trust in the WHO. I certainly have zero trust in the WHO to be a governing health body at a global scale. In fact, I think the bigger conversation shouldn't just be about the WHO. And this summit, and I'll slow down a little bit here, I'm on a roll. This summit was about COVID. It was about the pandemic response. But if you look at the interrelations between those governments and the bodies like the WHO, we've seen many other centralized institutions involved in this: the United Nations, the World Economic Forum, Gavi, and many others, NGOs, the lot. And Nick Hudson, who was speaking at the event, during his panel conversation on the second day or the third day, I think really nailed the point when he said that until we realize that centralization, the increasing centralized world that we are living in, where authority is becoming increasingly centralized, that these do not provide the conditions for human flourishing. Until we realize that deep centralization of governance and power is in direct discord with human flourishing, then we have a problem. And I think that to me is bigger than the trust issue. It's the fact that over many years, and it's a pattern that recurs through history, we see the increasing centralization of authority. So I think there's a bigger conversation to be had about how do we decentralize? How do we decentralize the healthcare system? How do we decentralize the governance systems? How do we decentralize the economic system? How do we relocalize? How do we reinvigorate our local communities? And I'm not talking about 15-minute cities. That's a conversation for another time. Already recorded a couple of episodes on that if you're interested in more and my views on that. But here we're here to talk about the International COVID Summit, which covered an enormous amount of ground and ultimately showcases that internationally there is a growing sentiment now that this was mismanaged. It was, and that's putting it lightly. But there was malpractice and even malfeasance. And the big question about where we go from here is the important one. I left the room on Wednesday night, having sat through the vast majority of the talks, thinking there was a few trains of thought. Firstly, I thought, how on earth has this happened? How on earth has this happened? How is it possible that so many intelligent people involved in public health, in science, in technology, in law, even in pharmaceuticals, how did so many people, under the guise of a public emergency, get things so wrong? That's a question that there are many answers to, but there is more questions than answers right now. And again, the speakers across the few days, they varied from believing this was a systemic failure as a result of centralized planning, coordinated, lockstep centralized planning. And there's an element of absolute truth to that. And there are others at the end of the scale who witness this as the consequences of a crisis mentality, where just chaos and disorder leads to a breakdown in normal functioning. But everything in between, complete coordination to complete cock up, for want of a better word, came through across the weekend, it was the 2 days. But there is some really interesting philosophical questions that are emerged, particularly around ethics and morality. Dr. David Martin spoke about several things that certainly raised my attention. Even though I missed his talk, I've watched it in retrospect and seen his conversation about the risks of licensing and patenting genetic organisms, which leads to things like gain of function research, which you could argue has contributed, for those looking at the evidence of the COVID origin story, could play a key role in being the root cause of all of this and the risks involved. But the bigger question around that, which I thought was put beautifully, is around the hijacking of science, the hijacking of ethics, the hijacking of morality throughout the last decades has resulted into this position that we find ourselves in. And to me, that's part of the philosophical consequence we need to have, the conversation we need to be having now around how do we restore open science? How do we restore ethics and morality, not just within the bounds of science, but within technology, politics, the economy, it's really comes down to principles and values. And it was really interesting to see that how that had come out so early in the conversation. Um, and of course, then that followed, a conversation, as you would expect, around the lack of utility of any of the interventions. Now, things got really interesting around the analysis of behavioral science, propaganda, and how this fear-based messaging was used rather than transparent public health messaging, which again plays into what I've just shared around the ethics and morality around science, because where is the ethics around nudging people and using behavioral science and propaganda in public health messaging? In my view, there is no place for public health, for propaganda or psychological operations within public health messaging. The issue of censorship and the smearing of doctors was talked about. There's an entire body of work now emerging looking at the consequences of the media's involvement over the last few years, and what can be done to break up the powers within the media and the concentration of power within the media. And again, it comes back to that point around concentration of power. Now, the big question, which I don't know what degree, speaking of censorship, I don't know to what degree and end I can talk about this, because I'm streaming this right now to Facebook. And if you're watching this on Facebook, please hit the share button, because my account is restricted for at least 90 days, according to Facebook, which feels like a semi-permanent ban, which means that basically, despite at one point broadcasting to 3,000 to 5,000 people simultaneously, quite frankly, a small stadium simultaneously during the course of the pandemic, now I can barely reach 10 to 15 people because the content is so throttled. So I need your help on that. But talking about vaccines is almost a forbidden subject, and a large part of the investigation, or the committee on Wednesday, talked about the pathological impact of the COVID vaccines on the brain, the heart and lungs, the reproductive system, and all of the implications that come with that. And the very clear, even to someone without a scientific background, the very clear problem here is this artificial creation of the spike protein. And it's evident that the spike protein is behaving in ways that is causing consequence. Now, all-cause mortality, the rise in all-cause mortality was also discussed. Attention was paid to the fact that lockdowns and the closure of hospitals and healthcare settings is quite clearly having a lasting effect on both hospital waiting lists, diagnostics, and mortality. But the bigger question is, what impact have the pharmaceutical interventions had upon what we're now seeing in the UK, a 50-year high in all-cause mortality? And that's way beyond that window of time where we saw a temporary spike in mortality following COVID. So the question has to be asked, and should be asked, and where we can't get to it. Yeah, the problem is we can quite frankly, to a degree, only speculate, despite how clear the evidence is saying, because we don't have the transparency of data to answer the question clearly. And that's the big ask, the big request, the big demand, if you will, across the entire summit, was that we need now to be having full transparency over the public health information and data, and that clinical coding practices need to be revisited so that when someone passes away, we know their vaccine status, we know the time that they had it. There's a whole range of other factors that are being suppressed. But there was a very interesting conversation around the difference between correlation or association and causation. And there are a number of key points that were raised. Number one is that we're seeing a temporal association between the pharmaceutical intervention and mortality. We're seeing a dose-dependent relationship between the pharmaceutical intervention and mortality. We're seeing a repeatedly found pattern. We're seeing this pattern emerging independent of any seasonality. We're seeing a lack of feasible explanation by other causes other than the latter that I mentioned from the closure of hospitals and healthcare settings, which will account for a proportion. But we're also seeing this described in multiple countries simultaneously, whereby they have had similar pharmaceutical interventions and similar volumes. So there are very clear points of evidence, but until we can get the full information and the wider scientific population begin to look at this, we're gonna remain on the fringes, quite frankly. And in order to reach a point of consensus, which is quite clearly a desire from the participants in this summit, we need to engage more broadly with the wider scientific and public health community. But there's a great deal of fear, as Jessica Rose and I talked about, Dr. Jessica Rose and I, which we'll see in a forthcoming interview that we recorded there. Jessica also mentioned during her talk and talked about this criteria called the Bradford Hill criteria. You can read about that. It's a framework for evaluating causation via epidemiological evidence. And she was beyond convinced that the Bradford Hill criterion had been met with regards to the pharmaceutical interventions and the increase in all-cause mortality. Now, this really raises some serious questions and some serious harms that, quite frankly, are still being ignored. And despite summits like this and talking about causation versus correlation, despite the temporal association between this summit and Tedros the following day declaring the public health emergency of international concern being over, as much as people like to celebrate victory, I think it would be false to claim victory from this summit. You decide. But I think that is simply temporal association rather than causation. But it is a milestone. Both elements are milestones. So there's lots to take away. But there still remains more questions and answers about where do we go from here. One of the key things that I think is important from here forth is, especially having sat in that summit for 2.5 days, I think now it's a case of distilling the vast body of evidence into a concentrated form, to summarize the key evidence and to start creating really concise reports backed by comprehensive evidence bases. Because the reality is, despite the vast amounts of knowledge now, it's really still publicly difficult to access. We require now, I believe, to create consolidated evidence packs that will make it really simple to understand, really easy to distribute, with verification, verifiable evidence. Because now we're 3 years in, we have an enormous amount of sources and credible sources at that. The second thing I mentioned quite clearly within this conversation, that this was not a public hearing in the sense that this is a parliamentary event speaking to an audience of parliamentary members. Despite parliamentary members being there, it was not an official hearing. But that said, there were members of parliament there. However, the majority of the people in the room were either there because they were speaking, or because they belong to organizations or bodies of work that are in support of the messaging from the International COVID Summit. My view now is that we need to break beyond the echo chamber, and even in the way that room was structured as like a spherical, a giant circle, amphitheater. We now need to fill the room with people with contrasting views. Because even amongst, there is still no distinct consensus across all matters. Even on the panel discussion on the third day, there was a discussion and dispute and debate around certain elements concerning some of the specific points around the vaccines. But that's the type of conversation we need to be having. We need to be having open conversations with roomfuls of people who are from opposing viewpoints, and to really scrutinize and challenge the evidence. Because even though I can see quite clearly these patterns, the conversation around the incidence rate is still unknown. when we're looking at this pathological evidence with the implications of the spike proteins on the brain, the lungs, the heart, to what scale is this happening? I don't think we can see that. We need to get that deeper understanding, but we need to open up the conversation. And then thirdly, we need to start thinking strategically and tactically about how we engage this conversation with the wider public and the wider political realm. And that needs to lead to very structured conversations around how we tackle each of the problems that has arisen over the last few years. And there's too many. I mean, I've been collating the lists of problems that we've faced, and it's pages, and trying to get to the root cause is critical. But we've really got to be clear on how we solve each of these problems and start being solution focused. And that is just in the context of the response to COVID-19, because when you open it up to the wider analysis of the political elements, the economic elements, the corporate elements, the legal elements, the social elements, economic incentives, we can see that there is a real requirement for thinking differently about how we coordinate and operate as a global world on a local basis. There's a much bigger conversation about culture. There's a much bigger conversation around economics and politics. And that leads me to my final conclusion around where things need to go, is that in the same way that we critiqued the SAGE committees for having a very narrow field of expertise, we have to be careful we don't do the same thing. So that means having summits that incorporate the wider body of economists, politicians, social scientists, legal professionals. And yes, there were elements of that within this summit, of course. And this isn't a criticism of the summit. The summit absolutely delivered upon its objectives and did a stellar job of doing it. But I think moving forward, we need to be looking more widely in the same way that Nick Hudson and the Panda Group are doing, looking at these wider conversations, because they are all connected. And the centralization of the bodies within each of those sections is a critical point. So, is Parliament listening? Well, a little bit. We've stepped forward. It's one small step for mankind, one giant leap for the COVID accountability that we're seeking. There's much more work to be done, but fascinating experience, a heavy experience. Listening to all of that evidence in a concentrated form is heavy. It's heavy, but it's that heaviness that drives me personally and many others in the room to want to continue the journey so that we can make it light again. Because we have to find a way to not only get accountability for what's gone before us, but find new ways of doing things to move forward to avoid things like this in the future. So I want to thank you for tuning in. Please do share this if you can. I've seen in the chat that some of you said that the share button's invisible. Yes, I'm being heavily censored. I don't think there's a single platform now, a mainstream platform, that I can broadcast on without censorship. So it's definitely time to shift emphasis to the likes of Rumble and Odyssey moving forward, because I can't have the conversation I need to be having here. But I broadcast this today under the Pandemic podcast brand. We did over 500 episodes during the course of the pandemic, live almost every single day during the peak of this. And we're bringing it back. We ran a survey, and 97% of our audience said they would welcome the return of the Pandemic podcast at this critical junction, to on a weekly basis to give a summary, because understandably, most people want to move on with their lives, but they still want to stay informed in a reliable, credible source. And I hope, through the thousands of emails I've received over the last few years and the kind words that I've received, many of you tuned into the Pandemic podcast because you knew that we were working very hard to fact check ourselves. We would only share what we could find credible evidence for. And, we're not perfect, but we work incredibly hard to do that, to bring you credible evidence. So we want to bring you a weekly show where we will just give you the headlines, the key information you need to know, the key developments, so you can keep informed. A show like this one, no more than 30 minutes. This one has gone up to 40. I've gone slightly over my plan. I hope to cap it at 30, but somewhere between 10 and 20, 25 minutes We want to create a weekly update on things that are happening as evidence emerges, but also as progress is moved. And we're trying to work out a subtitle. The original title was Pandemic Podcast Question Everything. That Question Everything is still an important piece. We kind of joked about making it like the Matrix Reloaded, trying to come up with a subtitle for the show that reflects the point of the story that we're in now, and the point of the journey where we start to also look forward, because there's much good work happening out there to address this, and increasingly so. So we want to keep you up to date with that information, in addition to the Elevate podcast, which takes a much broader and elevated view on the broader picture, and hopefully a more hopeful view on humanity. And of course, we've also got the Uncharted Territory podcast under the Elevate brand as well, which looks specifically at the changing financial landscape. So long term, it's my goal to bring you, I won't be involved in every show, but we're going to expand the media brand to bring you different conversations, different voices, to explore some of the most pressing issues facing humanity, and doing so in a very positive way that hopefully is solution focused, so that we can begin to make a difference in the world around us. So as I mentioned, if you can share this, please do. You may need to copy and paste the link directly because we're being suppressed. I can't do anything about that. It looks like it's a permanent ban. So I really do need your help. I really do need your help getting the word out there. And we'll look forward to sharing this on other platforms where we know we can be uncensored. So thanks again, as always. Enjoy your bank holiday weekend, whatever you're doing. And I will see you again next week. On Sunday, we'll be streaming our conversation with Nick Hudson. It's already available on Apple and Spotify and YouTube. But a lot of people like to watch live together. So we'll be live streaming it on Facebook. Not that we'll be able to reach anyone. But look out for it. We'll be streaming that with Nick on Sunday, so you can join in the conversation as we stream it. I'll be back again next week. Thanks again, and I will see you